as I see, I know you've been very instrumental in shaping Ashakalp Healthcare Association, and also as a representative of various individuals who are dedicated in the fight against tuberculosis. Cure also had an opportunity to work with you in one of the projects for screening for tuberculosis using AI. But today, I'm keen to hear from you about your experiences, thoughts, and learnings in this journey to ensure last mile delivery of TB care as a program implementer. So thank you so much. And to begin with, I think it would be great, Ashvini, if you can introduce yourself and the role that you have played in the public health space.
Thank you, Annu. In fact, a very happy new year to you and the entire team of Qure.ai. And honestly speaking, it's been a long journey of almost a decade or so that I've been working in TB control space. And in fact, I actually got into this space accidentally, I must say, because prior to that, I actually worked in education space for almost half a decade or so. Although I started with ICICI Bank, but I didn't really like it, and I actually left it in a week's time. So through a common friend, I actually met somebody who was actually looking for someone who could scale up with TB control work in the slums of Delhi and Mumbai. And I actually had a question that if we have a national program running for almost 6-7 decades, and still if 2 people die every 3 minutes because of TB, there has to be a problem, right? So in fact, I was basically intrigued by this question, and that's how I actually got into this TB control space. I'm basically from Rajasthan. I have worked in education space for about almost half a decade, and then I've been doing TB control for almost a decade now. And the piece that really excites me is to ensure the last mile delivery of all the services. So I think that's a brief about what I have done so far.
Great. Could you please tell me about the inception of Ashakalp and the projects that you have done so far?
Right. So Ashakalp started in the year 2014, and prior to that, I was working with a leading TB control organization in Delhi, and I was basically taking care of operations. And then, interestingly, I actually came across an interesting piece of article by Dr. Rao from ICAMR, Indian Council of Medical Research, and in fact, the paper basically talked about the high TB burden among Saharia tribal group in the state of Madhya Pradesh, and I was really intrigued by this finding, because they were basically claiming that the TB prevalence among this particular tribal group was something like 3,300. Right, it was like an epidemic out there, and nobody was talking about it. And we thought, and then I was also, in fact, of the opinion that I mean, if you look at the TB infrastructure in this country, you will realize that all the expert machine and all the infrastructure basically is installed in the urban setting, right? Whereas 2/3 of your population is still rural. Now, how do you make sure that, in fact, all the people who need to have an access to these services and infrastructure actually has an access to them, right? So that was the puzzle that we really wanted to solve, and I thought that since in fact a lot of organizations were already working in urban space, we thought that we should actually try and do something about this tribal group, and that's where we started. So we actually formed an organization, and we applied for funding, and fortunately we were able to get some money from the StopTB partnership. And it was a very simple intervention in which we were trying to hire all these rural youth as community health workers who were trained on, in fact, on identifying people with TB symptoms, collecting their sputum samples, transporting the samples to a laboratory, and also providing them with a treatment linkage. So I mean, that's what we started off with, and so we actually did it in Gwalior district of Madhya Pradesh in 2 blocks, basically, Bugati Gaon and Mohana. And in fact, at the end of the project, the impact was really good, in a sense that the overall notification was increased by almost 2.5-fold. And we realized that, in fact, there is a huge unmet demand, and somebody has to go and actually provide the services that are needed. And that's what we thought is important for a small organization like us, and that's how we started. And that's how in the subsequent year, the StopTB was again very generous and also helped us with a scale of funding. With that funding, we scaled up the work in Gwalior and Shivpuri district, and we were able to demonstrate the same kind of impact in both the districts. So the basic idea was to identify the community health workers who were essentially the local youth, train them on different TB aspects, would take their help and would try and improve the notification in the area. So these health workers basically went house to house talking about TB symptoms. They had their own motorbikes, of course, and we were paying them the salaries and a small allowance. And of course the incentives, and those community health workers went to the households of people who were talking about TB symptoms, collecting sputum samples, transporting the samples to a laboratory, and also that helping these identified patients with treatment linkage. And I mean, in fact, that's what we did for almost 2 years in Gwalior and Shivpuri. And so I think by 2018 we had a proof of concept already in place, and we were trying to figure out this question: if areas have this level of TB burden, we really need to figure out if we can find the same kind of high TB burden in other tribal groups. So with that idea, we actually went to Maharashtra, in the eastern part of Maharashtra, in 4 districts: Nagpur, Bhandara, Gondia, and Chandpur, and that's where we sort of scaled up the work, and we did about 2-3 years of work in those areas. And I'd like to mention that at the time of intervention, I mean, when we started the intervention, the overall notification rate in those 4 districts, combined was something like 44 per 100,000, which actually at the end of the project went up to 93 per 100,000, right? So there was a significant increase in terms of number of patients identified and initiated on treatment. So I mean, that's what we have been doing. And then of late in Rajasthan, we have been trying to engage the private sector also. I mean, with the central idea of for documenting the care cascade effect in these health facilities. We wanted to document how a patient comes there and how he or she is initiated on treatment. And we wanted to figure out if we can improve that process, because if you look at the MTB cases in these private health facilities at the moment, they are not really big. So I mean, we were curious to figure out as to what the reasons are, and if at all, if we can do something to increase that the number. So I mean, with that idea, we started a small project in Rajasthan, and we just completed with that project almost 2 weeks back.
What are some of the learnings that you have had so far, or any challenges that you had faced, which you think you could have overcome, maybe through additional support in any way?
Right. So I think first of all, we need to acknowledge all the efforts that the government is making, because I think we have traveled a long distance, right? So I mean, the national program was started sometime in 1960s, and now what we see is a fairly refined version of what it started off as. So I think all credit to the government, but I still see one of the things that is still a challenge, and that is a rural-urban divide, right? Because if you look at this infrastructure, if you look at the health facility and those kind of things, I mean, they are still an urban phenomenon, right? And 2/3 of our population is still rural, and how do we cover that last mile between the well-intentioned government policies and realities on the ground is something that we still need to figure out. So I think that's one of the things that I mean, we really need to see and find an answer to. Having said that, I think in the last half a decade or so, the government has actually done a tremendous job in terms of ensuring that all the TB patients have a small allowance, right? Called Nikshay Poshan Yojana, right? So I think that's a brilliant move, because I mean, we need to remember that nutrition has an important role to play in the treatment of TB, right? So allocating a small budget for that is essentially a welcome step that the government has done. And I also learned that going forward, in fact, the intention is to also have these CBNet-like facilities in the rural areas. That's also a welcome step that the government has come up with, and I think overall, in fact, the investment in TB has also increased, right? Because if you look at the different kinds of intervention that are there, be it PPSA, be it global fund money going into different areas of need, is in my opinion a welcome step. So I think we have done a few things really great, but at the same time there are few things like bridging this urban-rural divide in terms of ensuring the fact that everybody has an access to services is still a work in progress. In my opinion, we are on the right track, and we really need to expedite, because if we plan to reach the destination by 2025, I think we are actually short of time.
Even the challenge that you mentioned about the rural-urban divide, or how do we address that? I wanted to understand or get your thoughts on how can we use technology to achieve that? Because there is availability of technology, but accessibility is the problem. How do we address that, and what is your take on it?
I think if you have to expedite it, what technology has to be a catalyst, in my opinion, right? In the absence of technology, will not be able to do much, right? So I think what we have to understand is the fact that we really need to identify a lot of technologies which are already there in the market, right? Be it artificial intelligence, be it aggregation technologies, be it in fact other technologies for diagnostics. So what technologies have been around in the market? I'm sure there are plenty of things, plenty of ideas that are already there in the market. How do we integrate those technologies into a national program and try and take them to a next level is something where I think the help of the government is needed, because a lot of innovations are happening, right? If you look at the treatment adherence technologies, I can name at least 5, right? I mean, there are plenty of technologies which are there, right? When it comes to, I'm also aware of the fact that now even the access could be read. Could be read through an artificial intelligence software, and in fact, they can tell you accurately what the problem is, right? So it's not the absence of the innovation, it is how do you take those innovations to a scale is something that is more important, and I think that's where we need support from all the stakeholders. And I think it's about scaling those innovations to a level where we are able to in fact able to address those gaps.
What's your key takeaway in working with them?
I think being open and being open to failures and being open to changes is something that you always expect from a donor, right? Because if we have an idea, I mean, we will always be implementing it with the best of the intentions and with all the efforts, right? But at times you will not be able to come up with all the impact that you have talked about, right? But in that process, you need someone who can actually look at the numbers, who can be more approachable, who can tell you what's wrong and and at the same time what needs improvement. I think that's where StopTB has actually been a true partner. I mean, they have not been only a donor, but they've been a partner, right? Because I would like to share a very small story. When we started our intervention, in fact, in Gwalior, the initial idea was that we will identify the people with symptoms and will ask them to go to a health facility to get themselves tested. I mean, that was the initial idea that we had proposed. And very quickly we realized that we were identifying a lot of people with TB symptoms, but and we asked them to also go to a health facility. But in fact, these people were actually not going to a health facility. And we realized that it was not possible because, I mean, there were issues around transportation, there were issues around accessibility, there were issues around office hours, hospital timings, right? And which we couldn't have. Then we went to the StopTB again, saying that though we propose that we will be asking people to go to a health facility, but I mean, it's not working, and we will have to increase our spending, and we'll have to have a cadre of community health workers who will also collect the sputum samples from the household of the patient and will transport them, right? And that's and I mean, they were really open to this idea. They asked us, of course, a few questions that they really wanted to ask, and once we shared our side of the story, they were okay with that idea. And I think, that's where I think we were able to make an impact. Had we not been able to do what we really wanted to do in those initial days, I think in that case, I wouldn't have been speaking to you today, right? So I think being open is, and then I think also one of the things about the StopTB is their M&E team. I am a big fan of their M&E team. I mean, the impact assessment framework that the StopTB has, in my opinion, is extremely powerful, in my opinion, because it objectively captures, I mean, the historical trends and the contribution you are making and the impact of the contribution that you are making, right? And I mean, they are, of course, your evaluators, but they are, I mean, more of your friends. I just spoke to Rob for an hour today itself, right? So it speaks, I mean, volumes about the kind of openness, I mean, these kind of organizations have. So I think being open, being humble, being approachable, and being a partner, but not always a donor, is something that really makes a difference, in my opinion. And I think that's where the StopTB deserves all the appreciation.
While we speak about TB screening, recently we've also been hearing about the importance of bidirectional screening, and especially with the advent of COVID, we saw that that integrated screening is a great approach. How do you think, or what is your take on that, as well as whether Ashakalp would be exploring such projects where an integrated screening approach would be there?
I think it is an extremely important idea, if you ask me, honestly speaking, because it's not only about COVID. I mean, COVID is only 2 years old, but India has been a capital of diabetes patients, right? Right. And other than that, there are also other high risk group. And India being, I think, one of the largest and most populous country in the world after China, of course, has a huge population, and those and with the kind of lifestyle that we have, there are other comorbidities that are already there, right? So I think technology has an important role to play there, because if somebody is coming to a health facility, because I mean, in fact, this TB experience has already taught us that it is not easy to get one to a health facility. It takes a lot of effort to get one to a health facility. Before he comes to a health facility, he will, I mean, go to 3-4 different places. So bringing a health-seeking person to a health facility itself is a challenge, right? If he or she has come to a health facility, it should be a top priority to use such kind of technology wherein we are able to figure out as to what other problems could be. I mean, if he has TB, we also need to figure out if he has got diabetes, because that's, I mean, one of the risk factors that is there, right? So of course, of late, the NTP has, in fact, a provision for that. But I think how do you effectively use those provisions is also a dimension that requires more strengthening, right? Because we're largely relying on the kits as of now. At times, those kits are out of supply. As a result, we are not able to test, people for diabetes, right, or the sugar levels, right? So if we have a technology in place that can actually would deliver all the services, in fact, at one place, I think that would be a great idea for a country like India, which I mean, gets close to 2.5 million patients a year. If we can do that, we'll be able to address a lot of other issues.
Ashvini, but I think I'm just very curious to know any other projects lined up for Ashakalp. Like, what is your plan for 2022 or Ashakalp's project?
See, honestly, we will actually be taking a small break. To be honest, we really need to figure out what we really want to do next. I've been in touch with people. I've been exploring a few things, but at the moment, I think it's actually time to have a small break to reflect and see what we really want to do next. Yeah, but we'll be curious.